Good afternoon, everyone. My name is Elizabeth Papadopoulos. I'm the director of the Institute of Holistic Nutrition. It's my joy to be here today with Dr. Alexander Mostovoy. He is a clinician, a writer, researcher, and public speaker. He is recognized as an authority on breast health and cancer prevention. Since 1999, Dr. Mostovoy has been practicing homeopathic medicine, specializing in women's health and disease prevention. He has lectured extensively across Canada, the United States, South America, and Europe, educating and training physicians in breast cancer prevention and the use of medical thermography. He is very passionate about education, the art of medicine, and disease prevention. He is the best-selling author of the book, Breast Cancer is a Preventable Disease. And today he will be discussing all of the therapeutic applications, benefits, differences in the various imaging modalities that are out there, how thermography aids in early detection of inflammation in the body, and the role of thermography in maintaining breast health and early detection, including all the details on how thermography works. Let's welcome Dr. Alexander Mostovoy.
Thank you. It's an honor to be here with you. And just to kind of make sure that everyone understands, I no longer am in clinical practice. Thermography takes all of my time. And but as an introduction, I just want to mention that my journey started in 1988. That's a few years back. I got interested in holistic nutrition and exercise physiology. And then it took me to homeopathic medicine, and then it took me to thermography. So 25 years later, with thermography, here I am. I want to thank you all for, first of all, inviting me and for your interest in thermal imaging, as it's an interesting modality. It's something that even after 25 years, I'm still learning and discovering new things. So without further ado, I would like to kind of share with you what I've learned about thermography, and maybe it may be of interest to you to see how it can actually help you as a health practitioner. So first, just a brief introduction. What is thermography? I'm sure some of you have had personal experience, some of you may not, but I'm just going to assume that everyone is just starting out as a beginner. So thermography, or infrared thermal imaging, is basically a non-invasive diagnostic technique that allows the examiner to visualize and quantify changes in skin surface temperature. You'll see, particularly in this image, and on the side of each and every image, you will see a color scale. Besides the colors, you will see different numbers. The numbers are degrees in Celsius. So darker colors are cooler temperatures, lighter colors are warmer temperatures. The colors themselves are not significant. Sorry, I don't know why it's moving on. But what it gives me an idea is where the hot spots and where the cold spots are, whether we're looking at the thoracic spine, I think it's on a timer or something, or specifically kind of in the lower lumbar or sacral area. Now, why is it relevant? Because it leads to some form of detection. In other words, one of the primary utilities of thermography that it's potential for early detection. Now, the variance in terms of temperature can give us an idea about inflammation, about blood flow, about certain symptoms, and we can kind of combine that with conventional symptoms as well. Now, what attracted me to thermal imaging is that it gives us a holistic viewpoint. I'm sure you've heard this kind of old story about blind men examining an elephant. So the one who is examining the tusk of an elephant just says, wow, it's a spear. The one who is looking at the trunk of an elephant feels that it's a giant snake. Someone who is looking at elephant's ears gets a completely different interpretation. Finally, someone who's looking at the elephant's body looks at it as a wall, maybe it's a tree, maybe it's a rope. And to me, this is kind of equivalent to what modern or Western medicine has become. Everyone is an expert in their field, and everyone has a skewed opinion, but hardly anyone gets really a holistic viewpoint. So thermography provides a broader perspective, which can be invaluable in identifying root causes and not just symptoms. And I'm sure everyone has had personal experience with, as I said, kind of Western medicine, where it's mostly focused on symptoms rather than getting the full picture. So, why thermography? Well, because of the safety and comfort. First of all, it's one of those modality that's absolutely non-invasive. There is no contact, there is no radiation, and really it's a much safer choice for many applications, including where you need some form of frequent imaging. Let's say someone who needs frequent imaging, probably you don't want to use ionizing radiation that would include, let's say, X-rays such as mammography or a CT scan, which is great, but it's like 60 or 70 X-rays going at the body at the same time. Naturally, it's going to be very harmful long-term to your client or your patient. So why would thermography be considered is because, as I said, it's a complementary diagnostic tool. To me, I've always, when I teach other physicians, I always say, this is just an extension of your physical exam. So just like you would physically examine the patient, something that you're missing with thermal imaging is something obviously that you cannot see and something that is not really visible to you. However, it doesn't, of course, replace any other diagnostic methods, but it is providing additional tools, additional insight, if you wish. So because many clients or patients today are kind of demanding or asking for more of a comprehensive, more of a holistic approach in terms of their diagnosis and overall examination, we're looking at patients receiving the best possible care. So by incorporating thermography, practitioners can signal that they're naturally committed to leveraging all available tools to the patient for the patient's benefit. Now, thermography also has diverse applications. So it's not just detecting inflammation. However, you can also look at evaluating vascular conditions, assessing pain, even looking at dental health in terms of physiotherapy, whether something is working, something is not working. And so the applications, as I mentioned before, I'm learning new ways to kind of to apply thermography to different applications. And as a holistic or a diverse practitioner, this means that this is just one of many tools that can also serve multiple purposes. Now, here you're looking at patient empowerment because thermography is very pictorial. So when you're looking at this particular image of two hands, you're also looking at Raynaud's disease as well. You're also looking at someone that can show this to their patients and say, it's not just a figment of my imagination, but look, naturally, you should see all 5 digits or all 5 fingers here, but when it comes to temperature, it's almost as if this particular image suggests that the fingers are thermally amputated. Now, we know they're there, but we can't really see them because they're so cold. So conditions that I mentioned that require frequent monitoring will definitely necessitate a non-invasive, radiation-free nature of thermography, and that makes it naturally an obvious choice. So thermography is a tool with significant potential, and as technology advances everywhere in healthcare, it becomes more kind of useful in terms of early detection. And I'll illustrate, hopefully, as we go along and learn a little bit more, that even in some patients that are asymptomatic, and that's a very important kind of issue here, that you can get kind of that early warning system of what potentially is going to happen. So how does it work? What exactly is thermography for those of you who are not familiar? Basically, it's a diagnostic imaging technique that visualizes and measures temperatures or changes, I should say, in the skin's surface temperature. The way we use this, we use thermal cameras that detect radiation in the infrared range based on the electromagnetic spectrum. So the heat for a change comes from the body, produces images of that radiation. I always like to joke about this with our patients that instead of us radiating them, they're actually radiating us. Every organ in the body has its unique thermal pattern. So any abnormalities like inflammation or reduced blood flow or increased blood flow can be reflected as temperature change. This whole thing is based on a very simple concept that's called absolute zero or 0 Kelvin. Lord Kelvin, at some point in time, determined the absolute zero temperature that occurs in our universe. So what does that mean? All objects with temperature above absolute zero will emit infrared radiation due to motion of their atoms and molecules. Okay, so the warmer the object, the more radiation it's going to emit. How does it work? Well, as I mentioned, we are using thermal cameras to detect to detect infrared radiation. And this way, something that's not visible, we can see based on that energy being emitted. Then, as you've seen what we do, that information is collected, and the imaging software assists in kind of digitizing based on the color scale that I just showed you recently. The warmer the object, the more you're going to see that in reds or whites, and the cooler the object, the more you're going to see it in blues or blacks. Now, again, I don't want anyone to kind of focus on the actual color. It all has to do with temperatures. So, for instance, in this particular case, this is the basic, and the basic system is something that we're looking at hot versus cold, okay? We're also looking at symmetry. Symmetry is the key. So in other words, comparing left to right or right to left, whichever way your brain kind of works. And finally, delta T, or the difference between 2 points of reference. So you will see here, for instance, in this particular image, this is a hot spot. And why? Because this temperature is going to be probably around 35, 36 degrees Celsius. And I'm just going to focus on the face. So we have 2 parts of the face, 2 cheeks, we have 2 eyes, to ears. Everything is done as a contralateral comparison. In other words, if I see something, so let's go back, sorry. If I see something on one side, I want to see the same thing on the other side as well. Not only that, I'll measure this particular area and I'll get a delta T, the difference between 2 points of reference. Now, there's something that's called within the normal limit. Naturally, what I'm showing you here is way above the normal limit. Now, we can suspect that there is dental pathology as well as maxillary sinus involvement as well, okay? So what's the potential health issues? One is inflammation, which is huge. Second is nerve problems. Third is vascular changes. And finally, muscular injury that's also possible as well, depending on patient's history. Now, what are the limitations? Naturally, this is not the latest panacea, but if you're looking at absolute temperatures, what is the difference in terms of patterns? It's not a standalone diagnostic tool, but it should be used in conjunction with the tests and clinical information. And that's what I mean by clinical information is you're looking at your client's history, and let's say if they're concerned about the pain in their shoulder or the pain in their knee, you put them in front of the camera, you can confirm it, or you can kind of say, well, right knee compared to the left knee, there's definitely some form of inflammation. Most likely that's arthritic in nature, or you might have had injury. And I'll show you a couple of tests or a couple of clinical cases where it's going to be quite obvious what's going on. Now, what are the applications? The applications, these are just kind of a very short list. It keeps growing as we keep discovering kind of new applications when we can apply thermal imaging. But the big one, as probably most of you have been familiar with personally, is breast health. There's vascular health. There's musculoskeletal conditions, dental, maxillofacial, and a few others, which I'll try and kind of touch on as well. Now, so when it comes to breast health, thermography will detect variations in temperature of the breast tissue. Now, so these unusual heat patterns may indicate whether it's inflammation, whether it's increased blood flow, or other anomalies. When it comes to malignancies, right, where probably a lot of people are interested in that specific application, there's a basic premise that nothing will grow unless there is an additional blood supply. Because if you do have a malignancy, whether it's in the breast or anywhere else, it's going to require additional blood supply because malignant tumors are going to be growing, or metabolically, they're much more active, and therefore they need more nutrients, and more nutrients can only come from additional blood supply. So that additional blood supply usually is going to be unilateral, and it's going to be asymmetrical, right? There's a basic premise that nasty things do not grow in symmetrical patterns. So where thermography comes in terms of breast health is not only kind of in diagnostic terms, but also risk assessment. Who is at risk? Who's not at risk? When it comes to treatment or monitoring, how do you know that your therapy is working? Well, we can do before and after. And finally, there's going to be some form of risk stratification. In other words, someone who is high risk will probably want to have a more frequent recall and some form of aggressive follow-up. And someone who is at low risk probably is not going to require kind of an additional follow-up or an additional kind of tests in terms of further investigation. So just to give you an idea, again, when we're looking at risk assessment, remember, we're looking at asymmetry and we're looking at delta t, the 2 points of reference, right? So in this particular case, if you follow my cursor, you will see you don't need to be kind of a clinical thermologist. You will see that naturally this area stands out. This nipple is going to be significantly warmer than the opposite side. The supra and subareolar areas are also going to be significantly warmer than the opposite side. So this whole area, again, we're not diagnosing here, but definitely this particular woman is at much higher risk, irrespective of whether or not she's had most recent structural exams like mammography and ultrasound. I would definitely encourage her to escalate and to repeat some form of structural exams immediately after this. When it comes to treatment monitoring, as I mentioned to you before, you're looking at in this particular case versus, sorry, and this keeps jumping. This one versus this one. Well, there's only 6 months difference. And as you can see, the thermal window is exactly the same, from 26 degrees to 36 degrees, and here also from 26 to 36. It's only the difference that makes this particular before and after difference is indole 3 carbonyl 6 months of supplementation. That's all there is to it. Now, you can use I3C, you can use natural nutritional therapies. It just kind of gives you an idea what you can see and how you can track whether or not your intervention or somebody else's intervention is effective or not. Now we're looking at breast health. So on the left, you're looking at healthy breast. And on the right, you're looking at the image that shows breast with irregular patterns. You're looking at way more kind of a significant area here that require further medical examination due to potential and underlying health conditions. Okay. Now, when it comes to thermal imaging, you're looking at improved breast cancer detection. Again, naturally, I'm showing you very, very kind of dramatic difference between right and left breast. And you're looking at a significant difference, as you can see, in delta T of nipple area. You're also looking at kind of way more kind of what I would call a global heat versus the opposite side. So in this particular case, whether or not, again, if I'm looking at this and someone comes to us, whether their mammography is maybe not exactly, let's say, questionable, there are some questions regarding this, or whether or not they have had other structural tests, this is going to be escalated right away based on this image. Thyroid disorders. I find that probably 40% of peri and menopausal women will have some form of a thyroid condition. Unfortunately, conventionally, just checking for their TSH levels, thyroid stimulating hormone, may not be enough, because by the time women show kind of clear signs of irregular or abnormal TSH levels, by the time biochemistry catches up with our early signs of using thermal imaging, well, that may take a couple of years. So in this particular area, we're looking at warming of the thyroid region, and that's usually indicative of hot nodules. In this particular image, you're looking at, my apologies, I keep touching it and it keeps skipping. You're looking at cold thyroid region, which is usually associated with hypothyroid. So again, you also need to look at clinical or subclinical kind of symptoms, and that will give you a clue whether or not you need to intervene with whatever therapies you're using. Body heat is also very much indicative of what else is going on. In this particular case, I suspect that because the body temperature is significantly lower than average, this could be Wilson's syndrome, where her body heat, instead of, let's say, kind of skin temperature to be around 35 degrees, she may be 33 or 34 degrees. So again, naturally, when you take their case, you'll have an idea of what else is going on, and this may confirm what you suspect, or what probably is going on. So disorders such as hypothyroidism can also lead, of course, as you know, to reduced metabolism, a sensation of being cold all the time. So you can confirm what her symptoms are telling you as well. You don't have to wait for her TSH levels to, and by the way, we can have a whole new lecture on issues with properly diagnosing thyroid, but we'll leave that maybe for a Q&A or some other kind of time where we have way more time to talk about thyroid and other endocrine disorders. What we do with breast health, as I mentioned before, we kind of triage women that they come in for the first time, and we use this scale, which is TH1, which is the lowest, TH5, which is the highest. And this is based on statistical kind of risk of developing breast disease over a period of time. Based on our analysis, someone is going to be classified as TH1 or TH2, which is the low risk, medium risk, high risk, and so forth. And that's, as I mentioned, is based on statistical risk analysis based on their kind of thermal findings. Many of my clients or patients that come to our office may be on bioidentical hormones. In this particular case, I know the case because it goes all the way, as you can see, to 2007, 2010. But what I want to illustrate is what I call a blind spot. What I mean by a blind spot is that this woman was only taking progesterone cream. And as you can see, sometimes, and in many cases, it's absolutely indicated and it helps a lot of women. But in my personal kind of clinical experience, I find that maybe 1 out of 10 happens to metabolize that progesterone or aromatize that progesterone into estradiol. And as you all know, estradiol is a cancer prolific hormone. So in 3 years, we're looking at going from here to here. Naturally, this is a big problem now. Not only that her nipple and areolar temperatures are way above normal. So if you're just looking at blood results, you may miss this because breast is going to metabolize hormones separately. You're not going to see it in blood results alone. As I said, it doesn't happen frequently, but from time to time, even women that are only taking progesterone cream may aromatize that to estradiol. So someone's, let's say, who's taking progesterone cream, but also drinks 2-3 cups of coffee, that's going to aromatize that to estradiol. Someone who is drinking red wine at the end of the night, 2-3 glasses of red wine is going to produce the same effect. There are other aromatase agents that may interfere with their therapy. And then there are agents that are reduce that cycle. Aromatase inhibitors, as they're called. I want to talk about teeth and organs because some of you may or may not understand that when it comes to acupuncture meridian chart, that all goes through our mouth, and different locations of teeth also affect different organs. Just talking about breast health, you're looking at molars in the upper and molars as well as premolars in the lower jaw. There are other connections to other organs as well. So it's very important that when we look at people, again, when we're looking at people holistically, of course, everything is connected to everything else. In this particular case, it's a case study from way back where we're looking at the right first premolar, just around there, necrotic tooth. This was done as a dental x-ray. And then she also had a right bridge, also had a necrotic tooth. Now, she had thermography first, then she was referred to a dentist, and that's how we confirmed. And naturally, she would need some additional help. In this particular case, again, we're looking at lower left, right around there, necrotic molar. Here we have a case where initially this patient came in for thermography. She also had TMJ, and we sent her for a dental exam. There were no abnormalities, but a bite splint was done. She refused any additional dental work. However, about 6 months or so later, she had some sensitivity in the lower right side, about here. And then when dental exam also showed gingival inflammation, and a 7mm pocket extraction was performed. We had that early warning sign, as I said, in June of 2010, whereas it was confirmed later on with dental examination. I published a study in the European Journal of Ophthalmology in 2012, where we found that 70% of all our patients that we studied over a period of a year, 70% of them were completely asymptomatic, yet they have had early warning sign when it came to thermography. Very interesting idea. At some point in time, I started looking at women who have been already mastectomized. And what I've noticed that 9 times out of 10, she would also have some form of dental pathology on the same side. This is a letter from an oral surgeon that basically confirmed what we suspected. So now you can say, is it possible that because of her mastectomy that she had dental issues? It's possible, but it's not very probable. What's most likely happening here is that because of the dental pathology, that predisposes that patient, because it affects their lymphatics and it affects a few other issues, that predisposed that particular patient to having breast cancer as well. I'm not saying that's a causative thing. All I'm suggesting is that it works on that predisposition. And I've found that, as I said, in 9 times out of 10 with mastectomized women, we would see most likely dental issues on the same side as well. Huge. Case study, we're looking at TMJ. We're also looking at possible dental pathology lower left, right around there. That also involves lymphatics. And you will see that lower left on the same side will already have left nipple emission levels that exceed normal. So naturally, when we see something like this, we want to get a little bit more aggressive in terms of follow-up. Another case study, I also find that there's disproportionate number of women that will have TMJ as well as abnormal kind of breast thermography. In this particular case, unfortunately, this patient was diagnosed with breast cancer. So TMJ is huge. We see that in many people that are coming in for dental cranial or full kind of body thermography. Again, it's a huge subject. We just don't have enough time to address this properly as it requires, but just wanted to give you, as I said, this is just an introduction of where thermography really shines. This was a patient of mine that came in for full body. And when I looked at her breast, I said, well, yeah, there's something that's going on, but I wasn't really sure whether or not I should get very aggressive with her in terms of follow-up. But when I looked at her dental cranial kind of thermal imaging, and when I noticed this, I said, no, you know what? This may not be much, but looking at her kind of dental issues or possible dental issues, I said, let's escalate, let's get a little aggressive. Unfortunately, she had late stage breast cancer, which was completely undetected prior to all this. And again, this a letter of her pathology report. I know you probably can't see it well, but it is a well-documented case. Vascular health, huge. We're looking at vasculature here, one leg versus the other leg. So we're looking sometimes at a compromised blood flow, or in this particular case, this is something that can lead to potential kind of vascular issues. Now, musculoskeletal, we're also looking at detecting inflammation, identifying sprains and strains. And finally, when it comes to physical therapy, again, how do we know that it's effective? Well, we need to image these people to see before and after. Just to give you a quick rundown, you're looking at carpal tunnel syndrome here. Sorry. You're also looking at, I just went a little too far. You're looking at digit inflammation. Here we're looking at thoracic cooling, possibly involving stress to the right lung area. Ring around the collar is very, very common with women with thyroid issues, hypothyroid. Here we're looking at plantar fasciitis. And finally, we're looking at injury post-injury to the neck area. The V sign is very much kind of indicative of all sorts of issues, including fibromyalgia. If they don't have the V sign, it's probably misdiagnosed, someone who was misdiagnosed with fibromyalgia. Dental and maxillofacial, we're looking at TMJ disorders, as I mentioned before. Dental infections, sinus issues. So here we have very much kind of dental sinus issue. We're looking at most likely lymphatic congestion, possibly thyroid nodule. And again, this is not a healthy sign of their dental health. The benefits, when we're using thermal imaging, we can also assess nerve issues. No, it's not always hot. Sometimes when we're looking at cold, especially when we're looking at cold face or one part of the face, it could be post stroke patient. Digestive disorders, you may be interested in something like this. I'll show you a couple of interesting kind of cases. Crohn's disease would be definitely with increased heat. And finally, skin conditions, right? As I mentioned before, Raynaud's, which affect the blood flow. So here we have an appearance of the sinus issues, intestinal dysfunction in the mid as well as the upper portion of the abdomen, fibromyalgia, as I mentioned before, dental pathology. We're also looking at, in this particular case, when we take a full spine view, you're looking at a very significant shoulder drop, right? It's the same person. Now, I find that when it comes to 2 or 3 inches of a shoulder drop, it's usually not even the upper spine. Usually it's the lower spine that makes them go into a shoulder drop. So with this particular shoulder drop, you're going to see a lot of pressure on the right hip and a lot of kind of upward pressure on the left hip. But this is quite significant. That requires a lot of intervention, whether it's you're using a chiropractic help or osteopathic. Again, abdominal view, you see a lot of areas here that's very problematic as well. A lot of people are missing the ulnar view, and you can see here the ulnar view on the left side. What is that indicative of? Well, we know, sorry, it just keeps jumping on me. I better not touch my mouse. We know that the ulnar view is connected to C8, T1 spine. That's where the ulnar nerve kind of, with dermatome distribution, that gives us an idea when I look at the ulnar view in this particular case. I'm also looking at there must be a disturbance of the dermatome on the C8 T1 spine. Finally, we're looking at maybe something is going on here, right? That's quite obvious. Usually they will present with pain, and that's inflammation of the blood vessels here. When we're looking at the posterior leg or anterior leg, that's all indicative of different types of physiological conditions. Here we're looking, for instance, at the dorsal feet. That's arthritic condition of the dorsal foot as well. You can kind of read quickly the clinical comment, and just to kind of, I need to move along. In this particular case, here's what the patient presented with their clinical kind of point of view, where they have pain and all that, and we can see that clearly when it comes to looking at their thermal imaging. This is a very clear illustration of someone who has had an injury. That injury was recorded, and then after 3 months, we're looking at quite a significant improvement when it comes to their therapy. In this particular case, there was a significant injury to the left side of the knee. Again, 6 weeks later, post the knee was ruptured here. Post trauma, we're looking at there's still some pain in the kind of medial aspect of that knee, but definitely much improvement within 6 months. So you can follow up your patients with this as well. So what is the benefit of clinical thermography, and why would you want to use that as your as your kind of assessment in terms of your diagnostic toolkit? First of all, remember, it's non-invasive. We're not radiating your clients. We're not squeezing them. We're not touching them. And that's a huge advantage. There's early detection. It helps identify issues. Sometimes, even before the symptoms kind of set in, it's a much more comprehensive view. It offers, as I mentioned, a holistic view of the body's condition. It complements other modalities. Sometimes when it comes, let's say, to breast health, some, let's say, mammography or ultrasound results may be equivocal. You're not exactly sure. And instead of waiting for 6 months or a year, you can take a look at whether or not this woman is high risk, low risk, medium risk, and that gives you kind of a clue as to either you have to become a little bit more aggressive with your therapy, or you want to kind of escalate and be a little bit more aggressive in terms of follow-up. And finally, it's increased patient comfort and safety. So for those that may opt out from, let's say, other imaging modalities, this becomes, I wouldn't say an alternative, but at least some form of testing is better than none. So I'm going to kind of finish up right now because we will have a Q&A, but if anyone is interested in visiting our website, by all means, you can go to thermographyclinic.com. If you have any questions for us, for yourself, or for your clients, this is our phone number. And I want to thank you for your attention, and definitely want to take a few questions as we can. I think I'm on time, more or less.
Yeah, perfect timing, perfect timing. Thank you for a wonderful presentation, Alexander. That was
My pleasure.
yeah, very, very thorough. And it's so funny. We did a full massaging of all the names. We put them into a wonderful section of a wheel, and we pulled out the individual who just put up her hand. So let's first of all congratulate Judy Jeremiah for being the winner of Dr. Mostovoy's thermography session. And did you want to ask a question, Judy? It says here you has your hand raised.
We have quite a few questions,
Yeah,
so maybe
okay.
whatever
Okay,
you'd like to address.
Perfect. So first of all, does thermography detect nerve damage?
Yes, it will give a very good indication in some conditions. Now, I want to kind of qualify that not all conditions are going to be kind of suitable for thermal analysis, but definitely nerve damage can be in some conditions kind of detected by thermography.
All right, perfect. And are other anomalies such as thick breast tissue detected?
With dense breast, I think with younger women, or what they would call dense breast, an ultrasound is very, very kind of appropriate. An ultrasound will look at the structure. Thermography will look at the function of the breast. And that's the main kind of difference, because thermal imaging looks at how your breast functions. So before there are any structural changes, you're going to have some physiological changes, right? So before structure, physiology will be kind of prior to that, there are going to be physiological changes.
Okay. One of our instructors, Sophia Pistrila, is on, and she has definitely seen you in the past as a client and recommends your services. And she was asking if you could touch base on the baseline. So even if someone doesn't have a problem, the importance of getting one to have a baseline to begin with.
Thank you, Sophia. It really is a great question, because just like you want to have a baseline, whether it comes to, let's say, mammography, you want to have a baseline if you take a blood sample, you want to have a baseline with thermal imaging as well. What the baseline would allow us is, it's almost like having a fingerprint. Once we have that fingerprint or a baseline, we know subsequently which way you're heading. Are you stable? Are you getting better, or are you getting worse? So once there are kind of any significant changes, we can be alerted and alert the client, again, whether they're stable, whether they're getting better, or whether they're not moving in the right direction. So without the baseline, it's really very, very difficult to assess that. Because even if I see some abnormalities in the breast or anywhere else, how do I know that this is not her normal? Right? We all have anomalies.
Mm-hmm.
Once I understand that this is her normal, then I can say, okay, maybe it's really not normal according to others, but it is her normal. And that's the very important kind of distinction.
So she was mentioning here, she had a client that tried thermography. There were a few abnormal spots. They were detected in the lungs. She had subsequent CT scans at Sophia's insistence, and it revealed cancer metastatic to the lungs. So can you talk a little bit about the possibility of seeing cancer abnormalities in the lungs?
I'm surprised that thermal imaging is very limited when it comes to the lung tissue, because it's mostly occluded in the back by your kind of shoulder blade. So I'm not familiar with this particular case. So when it comes to lungs, there are a lot of limitations when it comes to thermal imaging. Many other areas, naturally, the breast, the face, abdominal area, mostly areas where I would say kind of visible in terms of inflammatory response, whether it's inflammation when it comes to dental pathology, or let's say inflammation when it comes to arthritis, or the opposite of that. As I mentioned before, it doesn't have to be hot. It could be cold, right? So cold is also indicative of subfunction or hypofunction.
Mm-hmm.
So it all depends.
Perfect. Okay, wonderful. Yeah. We have another faculty member, Angela Wright, and she was asking if you could tell the difference between cycle-influenced breast lumps versus cancer.
Which breast lumps?
Cycle-influenced.
Okay. Great question, by the way. A lot of women will have what is known as a fibrocystic breast condition. I don't want to call it a disease, because it's not a disease, it's a condition.
Mm-hmm.
So with the influence of menstrual cycle, as you know, there's a huge hormonal influence. There's a difference between day 5 and then day 25. If someone has a cyst in the breast, it's going to present, let's say on an ultrasound, very differently between days 5 and days 25. Day 5 is probably going to be fairly small, it's going to shrink, whereas with day 25, with the influence of estrogen, and a lot of women unfortunately are estrogen dominant in this day and age, or progesterone deficient, that cyst is going to expand. So if for any of you who are following up with an ultrasound, please follow up within the same period of your cycle. So if you're going, let's say, for imaging of ultrasound on days 5, next month or 6 months from now, try and go also on day 5, because now you're comparing apples to apples. If you're comparing day 5 to day 25, you're comparing apples to oranges. In other words, you will get skewed results with an ultrasound saying that your cyst is much bigger, but that's completely normal under the hormonal influence, right? It's going to shrink or it's going to expand. That's a normal kind of dynamic deviation. But your radiologist may kind of raise a red flag saying, wow, we're seeing an increase, and therefore we want to have some kind of a radical intervention. That may not be the case, as I said, because the results are skewed based on your natural kind of cycle. So how does that compare to malignancies? These are completely two different things. So most of the breast cysts are not going to have a lot of blood supply. As a matter of fact, they don't have a lot of blood supply. Whereas when it comes to potentially or risk factor for malignancies in the breast, those are going to in most cases, those are going to be with additional blood supply. That blood supply, as I mentioned before, is going to be usually on one side, not both sides. And that blood supply will have very different kind of presentation in terms of structure, as well as a difference in temperature. So probably something that I should have mentioned while we were looking at the images, that remember that delta T, the difference between 2 points of reference. So if one nipple is 5 degrees Celsius warmer than the other nipple, and it's the same person, the same 2 different breasts, of course, but why is one nipple 5 degrees warmer than the other nipple? Well, there could be other reasons other than malignancy, but generally nipple is being the coldest part of your anatomy. A lot of heat in that breast is going to go towards that cold point, right? So I'm going to get very suspicious as to why there's such a great difference between 2 points of reference.
Perfect. Okay. And how would someone find a local practitioner? Is there an association or a website if they live in British Columbia or outside of?
And there is an association called Canadian Association of Clinical Thermography. You can go to CACT. I believe it's CACT, Canadian Association, CACT. I don't remember their website, but if you search for Canadian Association of Clinical Thermography, you'll find it. Or you can call our office number and we'll put you in touch with registered members of the association who have the proper training and have kind of proper equipment, because it's not all the same. And there are rules and there are many factors that make one qualified and one probably less qualified. Also, their experience and who is interpreting their images also makes a big difference.
Perfect. Perfect. So just tell me the number and I can put it right in the chat.
Right. So you can call our clinic number, 416-636-2916. And whatever questions that we're not able to answer today, you can certainly address them. Oh, here we are. Thermography, but that's thermography. Oh, that's Thermography Canada. Okay, thank you for putting this in.
Okay, perfect. That's great. Now, is thermography reading safe and effective for clients who have any peripheral implants due to injuries such as pins, rods, fixtures for bone repair, artificial heart pacemakers, etc.?
absolutely safe. Again, remember, we're not touching them. We're not radiating them. There's no contact, there's no radiation. Yeah, it's that's actually something that drew me to this particular modality because we all have that kind of idea of above all, do no harm. And whether it comes to testing, when it comes to practicing, whatever modality is above all, do no harm. That's something that endeared me to thermography because we really don't need to give any potential of any type of injury while testing our clients.
Okay, perfect. And as a holistic nutritionist, would someone have access to this technology? Can they perform this test or refer their clients? So I think, Marcella, just correct me if I'm wrong, you might be referring to the similar technology such as BIE or live microscopy, if that's what you're referring to. She can let us know. And Dr. Mostovoy, is there a course on thermography?
There's no official course through the association. If someone is interested to kind of add that to their particular practice, again, contact us. We can put you kind of in touch and tell you what's involved. The majority of people that come to us naturally come through a referral network. So a lot of your members, a lot of people that are practicing nutrition have been referring to us over the past 25 years. We've had a lot of probably your members as well as clients. And we provide kind of reports to a referring, whether it's a referring clinic or a referring physician or a referring kind of health practitioner. So, if you're the one who's referring, then naturally we will provide you with report and clinical comments and the explanation as well.
Okay, great. And is there an optimal age to determine the baseline?
My youngest patient over the years was a 12-year-old girl who was already kind of mature in terms of her development. As we all know, women or young women go into kind of start menstruating younger and younger. Today, the average age is, I think, 9 or 10 years old, which is crazy. Only 25, 30 years ago, we had women in North America starting to menstruate, or girls starting to menstruate at 12, 13, 14, 15. That actually puts a lot of women at much higher risk as they kind of, as they will be reaching at some point in time their perimenopausal and menopausal kind of age. Nutrition, and I want to say something that everybody knows, but there's obviously an elephant in this room. Nutrition is the most important subject that's not even properly touched in any medical education, conventional medical education. Maybe they'll have like 3 or 4 or 5 hours of so-called nutrition where they are taught what's a protein and what's a carbohydrate. That's the most important subject. Everybody knows this, but for different reasons, and we're not going to get into politics of healthcare, we are not paying any attention to this in a kind of Western conventional medicine. So why would a 9-year-old or a 10-year-old start early menstrual cycle? We know that it is environmental. Nutrition, of course, has a huge component to this. Naturally, we have plastics, we have kind of xenoestrogens, a myriad of other things. And then on the other end, we also have women that instead of average age 50 years ago was 52 when they go into menopause, and now the average age is 56. So now we've added a good 10 years of menstrual cycles, which in itself is not kind of a risk factor in its own, but because we don't have multiple pregnancies as our grandmothers and great-grandmothers had, and of course we all know that multiple pregnancies are breast cancer protective, and breastfeeding is breast cancer protective. So our lifestyle has changed tremendously, and therefore we have an explosion of breast cancer. Okay, so again, that's a whole different subject for maybe another webinar, which I'd be happy if you're interested to kind of give you my idea why we have an explosion of breast cancer. But so the youngest patient that they had was 12 years old, who was riddled with cysts all over her breast. The way, again, conventional medicine is going to treat that is to put this poor girl on birth control, which is the opposite of what she needs, is just going to exacerbate her symptoms and really create a lot of problems for her as she kind of moves on with her life. It's the exact opposite, that the way she needs to be treated is not necessarily with estrogen, but most likely with progesterone. So that was the oldest. I was the youngest. The oldest, we get a lot of actually older women. I would say probably in her late 80s or early 90s. I know I have a lot of my own kind of patients that have been coming to us for a long time, and yeah, we have quite a few older women as well. But what really I find exciting is, as you know, because you've been doing this for a while too, people are becoming more and more aware of their health.
Mhm.
And I'm going to drop a bombshell that everybody knows already. The government is really not responsible for your health. You are responsible for your health as women, and mothers are becoming more educated. That's where the change is going to occur, and more people are becoming proactive, and naturally they're taking control not only of their health, but they're taking control of their family's health, because it's the women that are going to be forcing the medical community to respond to all this, not the men.
Yeah, excellent point. Yeah, excellent point. Judy, did you want to say something? You just have to unmute.
You already answered the question. Hi, how are you?
Okay.
Great, thank you.
Yeah, you already answered the question. Thanks. I just thought that there was a course on that. Yeah.
Okay,
There's something.
perfect.
All right.
Okay, Judy, and then Marcella, you also had a question? You just have to unmute?
No, I don't have a
You don't.
additional
Okay.
question. No, thank you.
No problem. Okay, perfect. Thank you, Dr. Mostovoy. And can thermography detect Hashimoto's?
I wouldn't say that it's the primary kind of detectable modality to detect Hashimoto's. It will confirm Hashimoto's, or it will confirm, or it will kind of lead to Hashimoto's diagnosis, because the thyroid area is going to show clear signs of hypothyroid, or the opposite, depending on the stage or the disease progression. So naturally, some form of abnormality when it comes to thyroid is going to lead to us asking for escalation or additional testing.
Perfect. And would the peripheral implants affect temperature reading of the localized affected body part, affecting their baseline?
Depends on an implant. If we're talking about, let's say, breast implants, those are temperature neutral. So I don't find that they kind of interfere one way or another. As I said, they're temperature neutral. But if you're talking about other body parts, you would have to be a little bit more specific.
Okay, perfect. Can animals have thermography?
Yeah, thermography is actually huge in every racetrack in North America and in Europe as well. Horses, especially race horses, are very, very kind of expensive animals. So not just equine thermography, but there are vets that will use thermography with so-called small animals like dogs, cats, kind of domesticated animals, also farm animals. But what's also important, as I mentioned, probably I didn't have kind of enough time. Thermography is huge in sports medicine as well. I know of many soccer, what do they call it, football in South America, Brazilian teams. Almost every professional Brazilian team will have thermal imaging there. So just like, and by all means, I don't want to kind of compare human athletes compared to horses, but they're also very expensive athletes. And in terms of injury prevention or injury diagnosis, thermography is used before and after the event, just like with horses. Everyone gets scanned to make sure that the athlete is either kind of, if they're injured, then they have to investigate right away, or if they have something pre-event, pre-game, they will sit them down. They're not going to allow them to get injured.
Very interesting. And do you advise having thermography after 2 or more negative mammography test results?
Great question. The fact that mammography is negative, to me, doesn't mean anything, because it usually takes 8 to 10 years for mammography to be positive. What does that mean? So in other words, mammography will detect a lesion that's going to be a small pea size in size. For a woman, average is going to take about 8 years to get to that point. So if mammography is negative in year 5, does that mean that there is nothing that's going on? Well, I suspect that I think everyone understands the answer to this question. Thermography may, on the other hand, indicate that there's some abnormality there. And just because mammography is negative, again, doesn't mean anything to me. Now, we can escalate to an ultrasound, we can escalate to MRIs, which are much more accurate than mammography. In the United States, they'll use a PET scan, other types of technology to properly diagnose a woman. In Canada, as you know, we have different type of healthcare with its own limitations. So unfortunately, some people are going to be out of luck. But properly done, if thermography is high risk, definitely in the United States they will use breast MRI, which is much more accurate than mammography. But you can also use different modalities. You can use mammography, ultrasound, MRI, and thermography. And when you combine all this, then you will have very, mid to high 90% accuracy. Not one test is just not accurate enough.
Yeah, that's excellent. We have some amazing alumni with us here today. Hi, Diane, Edith Kunst. Hi, Edith, Ella, Fatima. So nice to see everyone. So if you had any final questions, those were excellent answers, Dr. Mostovoy. Thank you so much. We have lots of people thanking you. They really enjoyed the webinar. Again, you can connect with Dr. Mostovoy at thermography.canada and thermographyclinic.com. It was a very, very thorough and excellent presentation today. We want to thank all of you for attending. And everyone is writing their thank you. Excellent presentation.
Thank you. And I want to, as I said, I want to thank you for your interest. Thank you for inviting me. It's an honor. As I said, you have been really at the forefront of kind of pushing a lot of knowledge and information. You know, as I said, I started with nutrition and exercise physiology a long time ago myself. That was kind of the beginning of my own personal journey. There's nothing that's more important when it comes to health than what people put into their mouth.
Oh, absolutely.
You know, it's amazing how many people you can help with nutrition. If you know, according to World Health Organization, which after the last couple of years, I'm not going to say that I'm enamored with that organization, but that's a different story altogether. But at least they did something right. They said, and I'm sure most of you know this, that 70% of all diseases are directly related to nutrition. 70%. So if we can eliminate 70%, this is going to be a completely different world.
Yeah.
This is definitely a new world order, quite a reset. But
yeah, totally agree. Thank you for making that connection. And I know in the world of science, when we say something is, you know, 80% or even 90%, that is kind of the unanimity of the whole industry. To say that it's 70 to 90% of all diseases can either be treated, prevented, reversed, and or eliminated through nutrition absolutely is very powerful. And together with holistic tests such as thermography, you know, as an assessment tool, it's a wonderful combination. But thank you for making that connection that what we eat every single day is absolutely critical and imperative in an individual's health. So,
well, there's no other activity that's more frequent than eating. Yeah, I can't think of anything, and we all love it. There's nothing like good food.
Yeah, oh, absolutely. Yeah, you can make things that are nutritious and good for the body and absolutely incredible to the taste buds. And thank you, LD. Yes, some beautiful comments here. Nice to see all of you as well. And thank you for all your wonderful inspiration. And I hope you can definitely reach out to Alexander and be part of, you know, his amazing mission with thermography as well. So it's a blessing to be on this path with you, Dr. Mostovoy. Thank you for joining us here today. We look forward to having you again in the future. And blessings to you and Tally and your beautiful family. And thank you so much for being on with us today.
And the same to you and everyone else. All the best.
Wonderful. Thank you, Dr. Mostovoy. Thank you, everyone. Bye-bye.